Okay.
But
The question
this pranic healing or Reiki has any influence whether they can teach?
Sir, we'll take it because there is a question on why not you only raised, why not become, add up all the good things from all the systems. So I think, Mayurji, that is where our ideal comes from. Whether cow dung can treat cancer or not, but we'll come back to it later. Let's go to the engineering part. Reality is stranger than fiction. But what is it? We talk about you take fats, you take carbohydrates, and you take proteins, and then you say, no, you decide yourself. Sir, it's not that we cannot tell you. There has been a person, Dr. Atkins, in US. In the US, all the public in US is advised on health matters by their Institute of Medicine, IOM. 1991, Dr. Atkins advised that you take Atkins diet, famous. So he advised you take this diet. 10 years it went on, 15 years actually it went on. And he was the most popular man in US. If you see those food pyramids, and now we know, no, maybe he was not that good. He died actually some years back, and when he died, he was weighing close to 130 kgs himself. He died of stroke because of the obesity, extreme obesity. Now, the point we are making is not that we should tell you whether you take carbohydrate or protein or fat, because as we said, these things are dynamic. There was a time somebody said you should not take desi ghee. My wife is sitting here, she says, you leave your medicine in the hospital, I am going to buy it. For 30 years, 32 years, she has bought this desi ghee every time she has got vacation. Now we say, no, it's not so bad. We can use it, Now medical science also says it. The point we are making is not that we are going to tell you do this today. The point is, we will tell you why you should do what you are doing. If you are going to use desi ghee, you are using it because you think there are some antioxidants there are some unsaturated fatty acids there, or whatever is the reason. We have talked about the fats and oils. So it's not that we don't want to tell you. There are times when doctors should try to give a direct hint, this is in your interest. And that is when it comes to taking decisions on sick patients. In fact, US also, which talks about informed decision, for the past decade is moving in favor of doctor taking the decision for the patient. But when it comes to taking decision on everyday health matters, it is left to an informed decision by the patient, so that next time something comes up, they will upgrade themselves, even when there are no programs of Consumer India here, or even if they are there. So I think that was the idea we were taking up, and nothing else. Yeah. The questions, now there are three very important questions have come. Why not add up all the, no, Sandeep is not the right man. I think Slim is the right man. Why not add up all the good things from all the systems of medicine and give the best to the public?
I think this is a valid question, that why not add up all the good things. But one thing that I strongly feel is that medicine is a scientific, evidence-based treatment. Now, homeopathy is exactly opposite, where they talked about dilution, and then come without any evidence. Once you start mixing 2-3 sciences, I think there is a problem. The important thing to remember is that keep everything in moderation, and I have no objection to using other forms of medicine along with the regular medicine that you have been prescribed, which is scientifically proven. If there is supposing a devastating cancer, and you suppose prescribe a certain chemotherapy, continue with that chemotherapy. If someone comes from homeopathy, please take this medicine and this session. I have no objection to that. That can be practiced along with it. No harm done that. At the same time, we have to be very clear that they should not be containing certain harmful agents. That's all.
I think very well said. So you cannot imagine that all the political philosophies could be given in the best manner by adopting the good ones from everywhere. You don't know what is a good one. But we did try, and medical science also tries to do these kind of fancy things which are done by corporates. About a decade back, there was a publication which said, not decade, it's about 15 years now, 20 years, 1996, I think, 94, that you create a tablet, they called it poly pill. The idea of polypill is, poly means it contains more than 3 items. It actually had 5 items. Each one benefits the man to the extent of roughly about 80%, 60, 70, 80%. So what they said, if each one is going to benefit the man, let's give it in a small dose so that side effects are not too many. But the benefits are there. And this smart Alec who came out with that paper, he said, let us multiply the benefits because we are giving 2 at a time, 3 at a time, 4 at a time, 5 at a time. And he said, if you give it to the rest of the world for their lifetime, 80% decrease in the incidence of heart attack, strokes, and renal failures. He actually said heart attack, strokes, and then the secondary was this. It was so shocking. It took 2 decades now for somebody to market it in India. Somebody is marketing it in India. It's total nonsense because it has no scientific basis like those 30,000 stem cells. But these kind of things come up. And to amalgamate different systems of medicine, it is not possible because they are based on different philosophies. If we can take a parallel from physical science, mathematics has got different systems. There is a geometry, there is algebra, there is a trigonometry, there is simple arithmetic. Now you cannot combine the two together. You will reach the same destination so long as you adopt one. So I think the same thing happens, and I have said it time and again. For diabetes, for example, the modern science says you must eat small meals many times in a day. The alternative or the indigenous systems, they say you eat one major meal, forget about the rest. So it is very difficult to amalgamate. It will create confusion, it might create bad things, and it will start a blame game. It cannot be done. But we might as well give different piece of the cake to different areas that can be defined whichever way, and as Dr. Balram said. You raised a very hot, vibration by saying, why not clone human beings? What's wrong?
I think it is against the philosophy of life. That is one. And as
he wants to know what is the philosophy. Ravinder?
Diversity, because each human being is different. Nature has not created two people similar, even twins, identical twins, monozygotic twins. They are also different in terms of their